Last February, cardiologist Dr. Ilana Kutinsky was in Nicaragua, and she had a problem. She was part of a group of doctors known as the Friends of Rudy, a medical mission made up of friends of Dr. Rodolfo Vargas of Birmingham, Alabama. Each year, Dr. Vargas leads a group of U.S. doctors to his homeland of Nicaragua to help give medical care to the underserved in that country, and Dr. Kutinsky of Detroit, Michigan, has volunteered many times for this challenging task. During that week in Nicaragua last February, Dr. Kutinsky implanted pacemakers donated from an American company. But several of her younger patients had a problem a pacemaker couldn't fix: Wolff-Parkinson-White Syndrome. This syndrome causes serious heart rhythm problems that puts the patient at risk for sudden cardiac death. Wolff-Parkinson-White Syndrome can be fixed by a procedure known as radiofrequency catheter ablation. But there aren't any facilities to do this procedure in Nicaragua, so Dr. Kutinsky had a problem. Would she leave several young people behind who had this syndrome when they could be helped back in the U.S.? At dinner one night during their stay in Nicaragua, Dr. Kutinsky approached Dr. Vargas, the leader of the mission, with this idea. If Dr. Vargas and his medical mission organization For Nicaraguan Health Incorporated would make the travel and visa arrangements for her patients, she would try to organize an effort back home in Michigan to treat the patients free of charge. Dr. Vargas agreed, and on a table napkin, the idea of Project Restore the Rhythm was born. In August 2008, it all came together. 9 patients, ages 15 through 31, were flown with all expenses paid to Dr. Kutinsky's hospital in Michigan, Beaumont Hospital, Royal Oak. There, with the generous donated help of many doctors, nurses, and support personnel, the 9 were recipients of cardiac ablation treatment, a big step toward resuming an active, healthy life. An anonymous donor paid all the travel expenses for each patient and accompanying family member, and host families provided food and lodging. In one weekend, all 9 received the finest medical care in the U.S., free of charge. These patients have no way to pay back those who have helped them. All they can give is a smile, a hug, a thank you spoken in Spanish. Somehow, it's that kind of thank you that gives the greatest satisfaction. This February, Dr. Kutinsky went back again to Nicaragua to do more volunteer work, as she has before, helping elderly patients with pacemaker and defibrillator implantations. But now she has another task: checking on the young patients that she and dozens of other generous volunteers helped to begin leading normal lives, helped to restore the rhythm. This is one of the many ways the nonprofit organization known as For Nicaraguan Health helps the medical underserved of Nicaragua. Check our website at fornicaraguanhealth.org to see how you can help us.